Greetings, dear learners. In the last class, we were learning analytical toxicology. Under that, we learned that most poison patients can be treated successfully without much contribution from the laboratory, other than the routine clinical biochemistry and hematology. But for certain conditions, we must seek the help of toxicological laboratories. Potential indication for seeking the help of toxicological laboratories are the prognosis to assess the outcome in case of poisoning, then research into the toxicokinetic and mechanism of toxicity, order from the court or the law enforcement officer, monitoring of the treatment measures and their efficacy, for the identification of the nature of poison, to assess the severity of the seriousness in a given case, and exclusion or confirmation of toxic exposure. For these conditions, we may take the help of toxicological laboratories. You may remember this seven names as the mnemonic promise. P, prognosis, R, research, O, order from the court, M, monitoring, I for identification, S for severity, E for exclusion. However, in Indian scenario, we must send the sample for toxicological analysis for all the cases of poisoning, whether it is accidental, suicidal or homicidal, belongs in the government setup or the private setup, as we discussed already in the medico-legal management of the poisoning cases. So, we are going to take the help of toxicological laboratories, usually the forensic science laboratories, that is officially the government supported laboratories. So, there we send the sample for the medico-legal purpose. For the treatment purpose, usually we are currently lacking the toxicological laboratories in most of the hospitals in the country. And I suppose that this is the basically need of the hour, that a toxicological laboratories shall be attached with each hospital, at least for the purpose of the management purpose. Then once the sample has got collected from the living body or the dead bodies, it shall be stored properly so that it doesn't get degraded and it is useful for the analysis purpose. So once the sample has been preserved from the patient, proper storage of the sample is necessary to avoid it from getting spoiled. Blood or urine obtained from the living patient or a cadaver is kept in a glass vial or a tube with a Teflon screw cap. The vial should be sealed completely. It should be airtight so that it doesn't get exposure of the external air. When a polyethylene or the plastic tube is used, the contamination of the sample by the plasticizer and other compounds should be taken into the consideration. Solid samples like organs and the tissues are separately put in a small polyethylene bags with the fasteners to prevent them from the drying. It is preferable that every sample should be taken in the duplicate, and one part of the sample shall be preserved at 4 degrees Celsius for immediate analysis in the laboratories, and the other part shall be kept at minus 80 degrees Celsius for the long storage and used when it is required. When the glass tubes are kept at temperature below 0 degrees Celsius, then the rupture of glassware due to expansion of the frozen liquids should be avoided by leaning or laying the tubes. Then after the sample has been collected, before sending the samples to the toxicological laboratory, certain bedside tests called as the color test may be performed. Also, these color tests are done as a qualitative analysis of the sample to know the particular specific test that shall be applied for to confirm the diagnosis. Many drugs and other poisons, if present in the sufficient concentration and in the absence of interfering compounds, give the characteristic color with the appropriate reagents. This is the basic principle behind the color test. Color test, sometimes referred as chemical spot test, provide the toxicologists and drug analysts with one of the first tools for the presumptive identification of drugs and the poisons. They are used to place the unknown into the specific class of compounds or to eliminate categories or the classes of compound. These color tests remain popular for many reasons. They are simple to perform and no extensive training is required to perform these tests. As such, they appeal in the situations where laboratory facilities may be very limited. For example, in the parts of the developing world, they can be performed in the field by the police officers or technicians, and also they require minimal reagents and are inexpensive and give immediate result that can be viewed by the naked eye. So for those reasons, they are one of the preferred tests, especially in the developing countries. Color tests are particularly important in the clinical toxicology, especially where the patient is being treated in accident and emergency, and clinical symptoms may indicate some form of poisoning. In these circumstances, the clinician needs to know as quickly as possible what substance or substances are involved in order to initiate the treatment. Under these circumstances, color test can provide an indication of the compound class far more rapidly than the immunoassays and the chromatographic techniques like gas chromatography or HPLC. Examples of the color tests that are particularly important in this respect are the Trinder test done for the salicylate poisoning, the Fujiwara test for the halogenated hydrocarbons, particularly used in the dry cleaning reagents, furforaldehyde test for the carbamate pesticides, test for cholinesterase inhibitors in case of organophosphate pesticides, then sodium dithionate test for the paraquat and diquat pesticides, and various tests for paracetamol including ferric chloride test, Follin CO Caltu, Lieberman's and Nessler's test. Color tests are widely used by the police authorities and the customs to detect drug of abuse. Important tests for the drug of abuse include the Marquis test for the opioids compounds and amphetamines, Mendelin's test for amphetamines, Scott's test for cocaine, and the Duquesne-Levine test for the cannabis. Color tests have also been developed for the gamma hydroxybutyric acid and the precursor gamma butyrolactone. Color tests range from those that rely on the reactions with the certain functional group like Follin CO Caltu for phenols to those that are almost specific for a given group like FPN reagents for phenothiazines, and to those that give diagnostic colors with a wide range of compounds. Like in case of Marquis test, where virtually the whole color spectrum can be encountered depending on the drug present. It is important to note that color tests are only an indication of the presence of compound or class of compounds. So all the tests must be confirmed by more specific tests. So the color test is just an indication of a group of compound. The confirmation for the color test by the specific method is very essential, especially where the test results may ultimately result in the custodial sentences for the administration of justice in the court of law. There, the results shall not be just relied on the color test. So the challenges before the color test, as we already discussed, are some of these tests are specific for practical purpose, but compounds containing the similar functional groups will also give positive color, and thus interference from the other poisons, metabolites or contaminants could be possible. Hence, color tests are not confirmatory tests but only a presumptive test. Another challenge is that color description is very subjective. Even in the people with a normal color vision, while the color produced usually vary in intensity or hue with concentration and may also be unstable. So color appreciation is very subjective. So one person may tell this tie of the red color while another person may say it of maroon color. Likewise, the different uh, persons may point the same color differently. So this is the major problem with the color test, and especially the color differentiation in this color test is very minute, where many of the color tests give a multiple spectrum of colors. So and the different compounds give the different color spectrum, slightly lesser deep, more deep, much more deeper, like that. So to differentiate them is very subjective. So now before performing the color test, some of the standard techniques shall be known to you. Like many of these tests can be performed satisfactorily in a clear glass test tube. So in a glass test tube we may do it. However, use of a spotting tile, that is the white glazed porcelain tile, as you can see in this picture, is considered to be a standard for the color test, as this contains the number of shallow depressions or wells in its surface that gives a uniform background against which to assess any color produced, and also minimizes the volume of reagents and sample that need to be used. So this white glazed porcelain tile is ideal for the color test. When performing color test, it is always important to analyze concurrently with the test sample. One, the reagent blank, and the second, a known positive sample at an appropriate concentration. Reagent blank is an appropriate sample known not to contain the compound of interest. If the test is to be performed on the urine, then the blank test tube can be the analyte-free urine. Otherwise, water is also adequate for the blank sample or blank test tube. And for the known positive sample, if the test is to be performed on the urine, then ideally urine from the patient or the volunteer known to have taken the compound in question shall be used. And for positive sample, if the test is to be performed on urine, then ideally urine from the patient or the volunteer known to have taken the compound in question should be used. However, this is not always practicable, and then a spiked urine sample, that is the blank urine, to which a known amount of compound under analysis has been added, should be used. So when we are going to perform color test on a particular test sample, then apart from the test sample, the color test shall be performed on the two other samples. One test tube shall be the blank test tube that shall contain the water or the known liquid that doesn't contain the compound. It is known that this doesn't contain the compound, and another test tube shall contain the liquid that is known to contain the compound, that is certain that this will give the positive result. If the sample is not available, then you add the sample or the known chemical into the water and then create a positive mixture for the analysis, so that you can compare the color change with each other. As you can see in this picture, here for the qualitative test of salicylic acid, that is Trinder's test, one is the test sample that has been taken with the interest to check the presence of the salicylic acid. Then another sample is the blank sample, that is the urine that doesn't contain anything. It is known that this doesn't contain salicylic acid. Then another test tube shall be the one that shall contain the salicylic acid. It should be known that it has salicylic acid. If it is not available such sample, then you take the salicylic acid, add it in the urine or in the water, and then perform the test. So in this way, you can compare the color change. So you can see here the color change is quite similar to the positive test tube for this test sample. So it is showing the presence of salicylic acid, although its concentration is stronger, whereas here the concentration is weaker, whereas this normal urine color is yellowish. So as you can see in the picture showing the color test for the salicylic acid, here one tube shall contain the test sample, then another test tube blank in which it is known that it doesn't contain the testing chemical, and another test tube that contains the known chemical. and the testing reagent is added to each sample and the color change is noted. In this way, we shall perform the color test. We should know certain important color tests for better understanding the mechanism of the color test. Like the color test for the salicylic acid is called as the Trinder's test. Salicylic acid is used topically to treat the various dermatological disorders. It is the principal plasma metabolite of the acetyl salicylic acid and can also arise from the metabolism of methyl salicylate and the salicylamide. Salicylic acid is excreted in the urine mostly as a conjugate with the glycine. The salicylic acid derivatives like the acetyl salicylic acid is most frequently used salicylic acid derivative. It is used as an analgesic. The estimated minimum lethal dose of the acetyl salicylic acid in an adult is about 15 grams. Acetyl salicylic acid is rapidly metabolized to the plasma state in vivo to salicylic acid, which is then excreted in the urine mostly as a conjugate with the glycine in the form of the salicyluric acid. Another metabolite of the salicylic acid is the 4-aminosalicylic acid. It is used in the treatment of tuberculosis. Methyl salicylate, that is the vial of wintergreen, is the another metabolite of the salicylic acid. It is a strong smelling liquid at room temperature and is widely used in topical medicinal preparation. On ingestion, it is more toxic than acetyl salicylic acid because it is more rapidly absorbed. Methyl salicylate is partially metabolized to salicylic acid. Another metabolite, salicylamide, is used as analgesic and on hydrolysis it forms salicylic acid. Salicylates gives a distinctive purple color with the ferric ions. This reaction forms the basis of the color test to perform the test. Trinder's reagent is used to perform this color test. The Trinder's reagent contains the mixture of 40 grams of mercuric chloride dissolved in 850 ml of purified water with 120 ml of aqueous hydrochloric acid and 40 grams of hydrated ferric nitrate and diluted to 1 liter with purified water. Then to perform this test, about 2 ml of the test sample, 0.1 ml of the Trinder's reagent is added and it is mixed for 5 seconds. A strong violet color indicates the presence of salicylates. As you can see here, this violet color is indicative of presence of salicylate. Blank is the urine that doesn't contain the salicylate, so it is yellow in color. The test sample shows the violet color that indicates the presence of salicylate and similar in color with the test tube that contains the known concentration of salicylic acid. The test has sensitivity of 94% and a specificity of only 74% for identifying patients whose salicylate concentration are greater than 30 mg per deciliter. False positive results have been reported to occur in neonates with the hyperbilirubinemia, premature neonates and children with extensive burns. So, this shall be kept in mind while performing the color test. Then another color test is the FPN test. This is done for the phenothiazine compound. These compounds are the derivatives of phenothiazine, which itself is used as an antihelminthic in the veterinary medicine. Some commonly encountered phenothiazines are chlorpromazine, chlorprothiazine, dimetothiazines, prochlorperazine, promazine, promethazine and thoridiazine. Phenothiazines are widely used as antihistaminics, tranquilizers and various psychiatric disorders. They are often extensively metabolized. Chlorpromazine, for example, has over 50 metabolites in a human. The FPN test is based on the reaction of many of these compounds with the ferric ion under the acidic conditions. This qualitative test is done with the FPN reagent that is prepared by mixing 5 ml of aqueous ferric chloride solution in the 45 ml of aqueous perchloric acid and 50 ml of aqueous nitric acid. The test is performed by adding 1 ml of the FPN reagent to 1 ml of the test sample and mix it for 5 seconds. Color ranging from the pink red, orange to violet and blue may indicate the presence of phenothiazines or their metabolites. As you can see in the picture, this is the blank urine, that is yellowish in color. Then this bluish color is the thioridazine. Then perfenazine is producing orange color and trifluperazine is producing slightly deep yellow color. So in this way, a broad range of color changes is produced depending upon the different types of the compound. So we may identify the particular phenothiazine compound or its metabolite that has been used by the patient or present in the sample. Tricyclic antidepressants such as imipramine may also give green or blue color with the FPN reagent. Similarly, false positive reactions may be produced in patients with phenylketonuria and the hepatic impairment. So, you can very well understand that the color tests are quite non-specific tests, as various false positive results are commonly encountered with the color tests. Then another color test is the Forrest test, that is done for the imipramine. Imipramine is a widely used tricyclic antidepressant. It is metabolized by N-demethylation to desipramine, which is also used as an antidepressant. Triimipramine and the clomipramine are the analogues of imipramine. Forrest test is based on the reaction of these compounds with the acidified potassium dichromate solution. Forrest reagent is prepared by mixing about 25 ml of aqueous potassium dichromate solution with 25 ml of aqueous sulfuric acid, 25 ml of aqueous perchloric acid and 25 ml of aqueous nitric acid. About 1 ml of this Forrest reagent is added to 0.5 ml of urine and is mixed using vortex mixture for 5 seconds. You can see this is the vortex mixture where this test tube is run and that shakes the tube and causes the mixing of the fluid inside. A yellow-green color deepening through the dark green to blue indicates the presence of imipramine, desipramine, triimipramine and clomipramine. As you can see in the picture, this is the blank urine that is slightly yellow color, whereas the positive result is shown as the slightly greenish blue color, that is suggestive of presence of imipramine in the urine. Then another test is the Fujiwara test, that is done for the trichloro compound. Trichloroethylene is well-known solvent and has been used as general anesthetic. Acute poisoning with trichloroethylene is normally from a massive accidental exposure or deliberate inhalation, as in case of the solvent abuse. As with some hypnotic drugs including chlorhydrate and dichlorphenazones, trichloroethylene, it is metabolized extensively to the trichloroacetic acid. This can be detected in urine using Fujiwara test. Fujiwara test shall be performed in a fume cupboard as the boiling of the test tube is done. Fujiwara reagents includes aqueous sodium hydroxide solution and the pyridine solution. About 1 ml of the test sample, 1 ml of the sodium hydroxide solution shall be added and 1 ml of the pyridine solution is added. Then mix it gently and then fit with a loose stopper and then heat the mixture in a boiling water bath for the 2 minutes. An intense red or purple color in the upper pyridine layer indicates the presence of trichloro compound. As you can see in the picture, in the test sample, First, we are adding the aqueous sodium hydroxide. Then we are adding 1 ml of the pyridine solution and then it mix it and then apply a loosely filled stopper and then heat it in the boiling water bath for the 2 minutes. Then the upper layer where the pyridine was present will produce a ring of the color change that may be of the red color or the purple color that indicates the presence of the trichloro compound. As you can see here, this is red color where there is a slight little concentration, where the concentration, that is positive sample, is showing the deep purple color. The blank analysis excludes the contamination with chloroform from the laboratory atmosphere. This test is very sensitive and will detect exposure to trichloroethylene even after 12 to 24 hours. However, other compounds also give rise to trichloroacidic acid in vivo, like the chlorinated solvents 1,1,1-trichloroethane and the tetrachloroethylene. So, the caution must be exercised in reporting the results.